Hello, Gillian, if you want to pop on.
Hello, hello. I see my little blue light blinking. That means you must be able to see me.
Let's hope so. Awesome. Okay, well, welcome, Gillian. I think everything is streaming as it should. So I'll just do a really brief introduction. So welcome everyone if you're watching. So my name's Katie and I'm a public health nurse with Ottawa Public Health. And so currently I work in the Parenting in Ottawa page on Facebook, as well as the @ParentsOttawa page on Instagram. So if you don't follow us, go do so right now. We're hosting this awesome series in the first so all through April, every Wednesday, we're going to be talking to specialists such as Gillian about perinatal health. So that includes the postnatal period, the perinatal period, all of those times, and especially including postpartum mental health. So Gillian, it's awesome to have you here on the page today. We're so lucky to have you here, and we're so happy that you took the time to speak with us. So I'm going to give you a little brief introduction of your bio. Okay, so Gillian, you are a health promoter and family support community worker at Carlington Community Health Centre. Gillian has been passionate about perinatal health and supporting families in our Ottawa community for over 25 years. You currently run the free online prenatal classes and postpartum sessions for new parents and babies under 6 months of age to help ease the sometimes bumpy transition to parenting. Oh my goodness, amen to that. Very bumpy. So I'm going to hand the floor over to you if you want to talk a little bit more about what you do at Carlington Community Health and let you do the presentation.
Great, thank you so much. I'm so excited to be here with you, and hello everybody who's going to be able to watch this session. So in case you don't know, Carlington Community Health Centre is located at 900 Maryvale Road, and we are the building that's been under construction for the last 2 years. But that means we have an amazing new building, and we have incredible programming for people at all ages and stages of their life, from pregnancy through to early child development, right up to seniors. So if you live in the neighborhood, as soon as our COVID restrictions have eased up a bit, please feel free to drop in and say hi. So I'm really excited to be sharing this with you today, and I'm going to sort of whip through a couple of slides that I've created for you, and then I'm going to be open for all kinds of questions, and hopefully Kate and I can have a big yak and we can answer all of your questions together, and hopefully you guys will feel very, very free to throw anything at us, because if we can't figure it out today, we will figure it out for you at some point in the near future. Okay, here we go. So one of the most important things that you guys need to do while you are pregnant and before your baby arrives is find a care provider for your baby. And the reason I put this rather glum looking woman on this slide is because I know that's really challenging right now. And a lot of people are reaching out to me saying, but Jill, I can't find a doctor. So I want you to know that there are a few things that you can do to help get a doctor if you are having difficulty. The first thing to know is you don't necessarily need a pediatrician for your baby when your baby is born. Unless your baby has significant health issues, you can absolutely have your newborn baby seen by your own family physician if they're willing to take them on as a client, or any family physician, or a nurse practitioner. So you don't necessarily need to have a pediatrician, and sometimes they're a little more challenging to find. You can also register with Health Connect Ontario, and I've put the number here up on the screen. When you register there, they will put you on a waiting list, and they will match you with physicians who register with them to say, hey, I have a few extra spaces, and then they will link you up. This takes time. So get on that list as early as you can, because it might be 6 or 8 months before you hear back from them. Network, network, network. Everybody you know, everybody you talk to. Hey, I'm looking for a family doctor. Do you know anybody who's accepting new patients? Everywhere you pop into, walk-in clinics, those apple tree clinics, sometimes they're accepting new clients, but ask when you're there. They might get you to fill out a form and it might just make it a little bit faster. Community health centers. Lots of people don't realize that many community health centers have primary care teams and they can take new clients. Often, however, our community health centers are working with clients who don't yet have an OHIP number. So if that's you, then that's definitely a place that you can go to get some care. Again, the apple tree clinics are often accepting new patients, but again, it may take a month or two to get you on the list. So don't hesitate to ask them. Online, you can also access telemedicine. There are various different organizations out there, such as Rocket Doctor or MD Connected, where you can call and speak to a physician in real time to have minor things done, like prescription repeats, or, I got a nasty bite on my hand that I needed antibiotics for, and I don't have a family doctor right now. I've gone through all of these things myself. And I'm on lots of lists and my fingers are crossed. So I had to call Rocket Doctor and they were very good. They got me the antibiotics I needed. They phoned them into the pharmacy for me and I could just go and pick them up. So that's something that you can use for sort of minor things. But it's really important that you're thinking about this now because it might take time. So please, please, please invest that time now before your baby comes to try and get connected to family medicine before that little one arrives. Once that little one arrives, you guys might be faced with some newborn concerns. And so I wanted to touch on a couple of things that are pretty common but can cause a lot of stress. Many of you are going to be making the decision to breastfeed, and that's absolutely wonderful, but you also might require some lactation support. And I've got a little bit more on the next slide talking about that specifically. But one of the things that you may need to do with your baby, and especially the first days or week, is to get your baby weighed. Now, if you have a family physician, you can absolutely have your baby weighed there when you go for your immediate postpartum appointment, usually within 24 to 72 hours of leaving the hospital. If you have a midwife, of course, your midwife is going to be checking up on you and your baby, so you don't need to go to a physician until you've done the transfer back. So for getting your baby weighed, where can you go? The CHCs are a great place to look into. That means the community health centers and of course the Ottawa Public Health Unit. So you can call 613 parents and you can often get your baby weighed on a Tuesday or a Thursday through Public Health. I believe they are still offering one in Orleans and one at Centrepoint. You can also see an Ottawa Public Health lactation consultant by appointment by calling the same number. And at the community health centers, just call the one that's closest to you and ask if you can speak with their lactation support team, and they will be able to get you in for a baby weight. Jaundice is something that is very common. This is when your baby's skin and the whites of their eyes may turn a little bit yellow. About 60% of new babies have some level of jaundice, and it usually begins after about 24 hours, and it's normally gone by about 1 to 2 weeks after your baby's born. But sometimes that can become problematic. If your baby is very sleepy, hard to wake up, and not feeding well, or if they have a really high-pitched cry and you can't console them, it is really important to get immediate help. Immediate help. That means going back to the hospital where you delivered, or calling your midwife, or going to CHEO. Any jaundice lasting more than 2 weeks, you need to see your primary care provider as well. And make sure that you reach out to a lactation consultant because often they can help you troubleshoot. Ottawa Public Health has a great video called Here Comes Baby, which is all about jaundice. So feel free to just sort of surf through their website and you'll be able to watch that too. Remember that any baby under 3 months with a fever needs to be seen. As babies get a little older and they start to teeth, sometimes fevers become more common when they're over the 3-month age. But under 3 months, we don't mess around. We want to see that baby right away. So I've put over on the right side of the screen The when to come to the emergency department. Now, this is on the CHEO website, and it's a really great resource. So again, go and surf through the CHEO website and familiarize yourself with it before your baby comes. Because trust me, if you've got a 2-month-old baby with a fever, you are going to be stressed out. And it's nice to know all of this stuff ahead of time so you know what to do and who to call. If you have a baby under 3 months with a fever, come to the emergency department. If they're very irritable or very sleepy and it doesn't improve, then go to the emergency department. Any babies having difficulty breathing, signs of dehydration, dry mouth, not peeing, those kinds of things need to be seen right away. So please, please never hesitate with a baby under 3 months of age. What if you have COVID? These days, everybody knows somebody with COVID. So if you have COVID or if you are isolating, what then? Well, remember, if you have an urgent medical need and a baby under 3 months with a fever is an urgent medical need, go and be seen. All you have to do is let the team where you're going know that you've been exposed to COVID or that you've been isolating or that you have COVID. For non-emergency situations, you can go to the COVID-19 care clinics. And again, all of those are listed on the Ottawa Public Health website. For essential medical appointments too, that means you've got a healthcare appointment booked for 48 hours after your baby's been discharged from hospital and you're positive for COVID, you still go. Or you get somebody to take your baby, but you should be going as long as you're able to. The trick is you have to let them know. Let them know, but still go. And if you're having trouble, and we've heard this in the community, that sometimes they'll call or somebody will call and say, I have COVID, but I'm supposed to come and see my doctor today and it's important. And there will be confusion around that. So if you're having trouble actually getting to see your primary care provider, please don't hesitate to come to the Parenting in Ottawa Facebook page, shoot out a little message, and one of the lovely public health nurses, just like Kitty, are going to be there. So you're going to be able to get an answer pretty quickly. Now let's look at some new parent concerns. There are a whole bunch of things that happen after your baby comes that are normal, but might seem a little scary. And then there are some versions of those that are not so normal. So let's talk about them and then you'll know. Bleeding from your vagina, even if you had a cesarean birth, is very common and usually lasts 6 weeks. It starts out fairly heavy and fairly quickly it should turn more of a brown, then to a pink, and then to a pale or a clear. Please don't use any tampons or put anything in your vagina for the first couple of weeks after you've had a baby. And if your bleeding is heavier than a period, if it smells bad, or you have big clots the size of a plum, please call. If you have a really sore perineum, that's that little piece of skin between the bottom of your vagina and the top of your anus. And sometimes you get a little tear there when you have a baby. If that's really, really sore, call. It's important to keep that area clean and dry. You can absolutely have little sitz baths with Epsom salts. That's a fabulous way to keep that area clean, but make sure it's dried well afterwards. Frozen maxi pads are awesome, or sanitary pads. Just pour a little bit of water on them or a little bit of witch hazel on them, put them in your freezer in a Ziploc bag, and then put them on your perineum for the first few days after you've had a baby. Feels fantastic. You will also get a peri bottle, which is a little squeezy bottle that you will be given from your primary care provider, either your midwife or the hospital. And it's great to squeeze that full of water onto your labia while you're peeing, and that really helps minimize any burning that you experience from stitches or from that little tear. Remember those Kegel exercises you learned about in pregnancy? Make sure you're doing lots of those after you've had a baby. And if anybody's having difficulty after they've had a baby with anything to do with their vagina, it's a good idea to see a pelvic floor physiotherapist. Constipation, let's talk about that for a second. Everyone thinks having the baby is the hardest part. Well, it is, but constipation can actually be really uncomfortable after you've had a baby, especially if you've had a cesarean birth. And statistically, about 1 in 4 of you will have a cesarean birth. If you have gone more than 3 days without a bowel movement, please call your primary care provider. Very important. Breasts, they're leaky, but in a good way. If there's a lot of pain, if you have nipple trauma, please again call. Take advantage of the resources I'm about to give you and call. When you're peeing, again, use that peri bottle to dilute that stream of urine so it doesn't sting if you have any tears to your perineum. But if peeing hurts, if it burns not just the place that's torn, but actually in your urethra, or you're passing very little urine in the first few days after you deliver, that's a really important reason to call your primary care provider. And again, 1 in 4 of you are going to have a cesarean birth, and that's going to require a little extra care, a little extra rest, but a few things to note. Don't hunch over and guard your incision. Stand up straight. Feels like that's counterintuitive, but standing up straight actually makes it less uncomfortable. And if you have a lot of pain or redness along that site where you had that surgery, please call. Headache, fever, swelling, little floaty things in your eyes in the first week or so after a baby comes, call. Bottom line here is if you're worried, call. And that means you need to know who you're going to call. So it's really important that right now you guys go and get your resources sorted out. You need to be connected early. Know who you're going to call about what before this baby comes. Who's it going to be? Primary care provider. That's pretty obvious, but some of you may not have a primary care provider, so we have to make sure we have other options too. Your lactation consultant. Which lactation consultant? There are lactation consultants free through the City of Ottawa, through the community health centers. There are fee-for-service lactation consultants who are also available in the community, especially if you have insurance. There are the La Leche League meetings, which are ongoing, which are wonderful peer support for breastfeeding families. Me, of course, if you're in one of my parenting groups on Facebook, you can always reach out to me. You can always reach out to the Parenting in Ottawa Facebook page and ask a question. The hospital where you delivered is also an important resource for the first few weeks after you have had your baby, your midwife or your physician. Telehealth, of course, you can always try telehealth. Ottawa Public Health 613 Parents Line, very important. Make sure that number is written onto your refrigerator with dry erase marker or stuck there with a magnet. And of course, the community health centers that are in your community. So if you're not already connected to your community health center, now's a good time to figure out where it is and to get connected. Peer support is really, really important. Lots and lots of you have been suffering greatly through this pandemic by being incredibly isolated. So having a community, even if it's an online community, is important. Just make sure that where you're getting your information, that information is appropriate and actually evidence-based. So Ottawa Public Health website, of course, the social media, of course, the CHCs, of course, and the Facebook Pregnant in Ottawa prenatal breastfeeding and parent support groups are literally one-stop shopping to help you navigate. So in case you're not already in those groups, this is what they look like. If you're pregnant, search Pregnant in Ottawa live online prenatal classes in Facebook. And this is where you're going to be able to join and get your prenatal classes before you deliver. And then at about 30 weeks, I get you all to join this group, the Individual Parent Support Group. It's Ottawa Prenatal Breastfeeding and Parent Support. And this is a great place where we meet every Tuesday and where you will also be able to get a lot of information and be able to reach out if you need support in a hurry. So what's next? Don't forget to come to the next awesome talks this April, because the next one in particular is really important. And if this hadn't been being done by somebody really, really, really brilliant like Dr. Valerie Giroux, I would totally have 3 slides in here just on perinatal mental health. So I really want you guys to make sure that you come to these next sessions because they are really important. That relationship with your baby presentation is also going to be amazing. And of course, infant feeding. Who doesn't need to know about that when you're pregnant? And Joanne is an absolutely fabulous lactation consultant. So please come along and see all of those next sessions. And with that, I will stop my yakking and you guys can ask some questions.
That was so awesome, Gillian. I couldn't help but just be like transported back to my postpartum days with my two babies and just sort of the blur that I existed in both of those times, but also having the resources and the support available during both of those postpartum phases for me and my family was like a must. So I'm so glad that you outlined some of the supports that are available to families, especially now as things have changed a fair bit with what's available, who you can see in person, who's virtual. So navigating that whole healthcare system now looks completely different than when I had my little ones. I was going to mention too before we started talking about people asking questions. So if you have any questions, please post them in the comments. We're happy to answer them. Si vous parlez en français et vous voulez demander une question, dites-le en français. On va répondre en français ou avoir un infirmière en santé publique vous répondre en français. Nous avons aussi les informations et les ressources disponibles pour vous en français sur notre page Être parent à Ottawa. So we'll wait a few minutes while questions come in, Gillian, but I do have some questions for you if you're prepared. I'm sure you are. I'm sure you've covered all of these hot topics. So one of the questions I did want to ask, or that was asked, is what can I expect at my first baby's checkup? So what are they going to do to the baby, and what are they going to ask, and how should someone be prepared for that?
That is a really great question. So obviously that first baby checkup is there to make sure that that transition to life from inside the womb to outside the womb is going okay. So they're going to check your baby's vital signs, their breathing, their temperature, how they look, what color they are. They're going to look for that jaundice that I talked about earlier. They're going to ask you some questions about how the infant feeding is going, how many peeps and poops you're getting on a regular basis. Those kinds of things. They're going to ask you if you have any concerns about your baby, because you know your baby better than anybody, even though you may have only had your baby outside you for a couple of days. So it's really important that if you have concerns, you bring them up with your primary care provider at that time. Some babies, if they are a little on the yellow side, they may get tested to see just how much bilirubin, and that's the substance that causes that yellow skin and that yellow sclera, is in your baby. And they might do that in one of two ways. They might take a special little machine and hold it against your baby's head or against your baby's chest. And that measures, by sending a little light beam into your baby's skin, how much bilirubin there is. Or they might do a little heel prick and take a blood sample just to make quite sure. So those are two things that might happen at that first appointment. They don't always happen, but if your primary care provider isn't comfortable with the color of your baby, they may ask to do that just to be on the safe side and make sure that it's the normal kind of jaundice and not the kind of jaundice that might become problematic. Did I miss anything there? Was there anything else I should add there?
I don't think so. And Gillian, can you go back to the slide that shares when you're supposed to call? Someone was just requesting to go back. And I just do want to mention that we will have this presentation available on our Facebook page so that you can like scroll through freely to each page if you'd like, or watch the whole thing again if you want to take notes. But it's not all going to be gone after we log off of this presentation, just to reassure you. Okay, so on to the next question, Gillian. So we did talk about not having a family doctor. So you did give some information about that. So that's great. Somebody was wondering too, like, how do I know my baby has a fever and how do I take their temperature?
That's a really great question. So you know if your baby is feeling warm to you. They are literally, you're saying, that baby feels warm to me. If you are concerned about your baby's temperature, you can take your baby's temperature with one of the little thermometers that are available at pretty much any pharmacy now. They do have forehead ones, and they also still have the ear ones, but we don't recommend that you take a temperature in any other way. You can take it underneath the arm if you've got a really old-fashioned thermometer, but I'm not sure too many people have those anymore. So I would recommend that you're just using the one that's taking it from the forehead or from the ear. And then if your baby does have a fever, it's very important that you have them followed up right away. Also, if your baby's feeling sweaty, and this is actually a good place to talk about how do you dress your baby when they're new babies, because if you have a baby in February, the tendency is to want to bundle them up a lot. But here's the thing. A cold baby or a chilly baby is going to let you know all about it. They are not going to be a happy baby, but a very overdressed baby tends to just sleep. So if you feel the back of your baby's neck and they're all sweaty, they have too many layers on. So the rule of thumb is one more layer than you are wearing, and maybe a light sheet over top. And if you're wearing your baby in a sling, remember, you've got that baby really close to your body, so they don't need to be bundled up in 9 layers. They just need to be in something comfortable so that they're not sweaty and they're not overheating. So just kind of watch that and test a few times and sort of peel back the layers until you're finding that your baby is warm. They don't have frozen little fingers or toes, but they're not all sweaty and overheating as well.
Had to find my unmute button. Okay, so that's an awesome answer to that question. It's always like, especially with certain thermometers, right? Like where you're reading digitally or Fahrenheit and Celsius. So we have tons of that information too on our Parenting in Ottawa page about fevers and how to take a temperature. Okay, so the next question, if you have time, Gillian, is somebody was just asking about bath time and like when you take your baby home and when are you supposed to give them their bath? How often are you supposed to bathe them? And how can someone learn more about bathing their baby?
Great questions. Definitely, Ottawa Public Health website does have a lot of information on that too, but the bottom line is that you do not need to overwash your baby. Your baby is born with lots of good bacteria on them from you, and so washing them all the time, every single day, actually depletes their skin of really important oils. So my mom used to remind me when I had babies that topping and tailing them are really good. So you wash their hair and you wash their bottoms, vaginas, scrotums, all of those areas, keep them nice and clean. But you don't necessarily need to give your baby a full bath every single day. So really it comes down to what season is it for me. So a bath, once a week, twice a week in the middle of the winter is plenty. In the summertime, especially as your little ones get older, they're going to get hot and sweaty and covered in milk and kind of stinky. So you're probably going to want to bathe them a little bit more often. And trust me, when they're toddlers, they'll need to be hosed down several times a day. So as newborn infants, the general rule of thumb is that you want to make sure that their head, their hair, their faces, their necks, all the little crevices are washed, but you don't necessarily need to fully immerse your baby every single day. And remember that having a bath with your baby is actually a wonderful way to practice some additional skin to skin and to, make sure that the water temperature is perfect for your baby because you're already in it. So you're going to know if the water temperature is going to be perfect for your baby. Make sure you're bathing with help if you're going to be bathing with your baby so that you can have your baby on you. You can have that nice snuggle time, that nice wash time, and then a partner or support person can help take that baby safely out of the bath while you hopefully get a chance to sit there and just relax for another couple of minutes by yourself. Make sure that when you are bathing your baby, that they're never, ever, 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 ever for a second left alone, ever. And never, ever, 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 ever. Sorry, I have to repeat those. I know it goes without saying, but no bath, seats or gizmos that hold your baby's head up out of the water. Those are not safe for babies to be left. So when bathing, it's always really important to make sure water temperature is appropriate. Scalding can happen very, very easily. So just be very careful about the water temperature and make sure that they're never left alone, because an infant can actually drown in 2 inches of water. It does not take much. So those are some safety concerns around bathing, but when it comes to it, just really enjoy it. And bathing with your baby is a really wonderful experience for any partner. It's really fabulous. I actually really miss that from when my kids were little. Sorry, that was a long answer to what could have been a really easy question.
No, I think like more details are better. So Gillian, I'll get you to stop sharing your screen just so that you and I could both appear together sort of for these final closing remarks. So I think like, you've given such good information to parents about, sorry, I'm just going to make sure that I'm in gallery view. I think I am. Okay. You've given such good information to expecting parents, people who are maybe thinking about becoming parents, or people who are pregnant, or people with very new babies. So this is awesome. It's been hard for new parents in the pandemic in the past 2 years, and that's something that we've acknowledged and seen. So making sure that parents feel well supported and know about the resources available is like the number one thing. And like you said, kind of adding that extra layer of like knowing what's available to you, knowing who you can see, who you can talk to, and having those support people lined up is definitely by far like having your village ready for you, right? So I do want to say thank you. I don't have any more questions that have come in for now. I'll just do one more double check.
I've got one more sort of closing thought that I want to share with all of the new parents who are out there.
Yeah.
And that is, there is a big difference between what is culturally expected and what is biologically normal. And so when these babies come out of us, there's a lot of pressure on parents. We hear it from everywhere, from friends, from family, from Facebook, from everywhere. And I just want to take the pressure off and remind all of you parents that you guys are still a unit. For the first month after that baby's born, even though someone has technically cut the cord, you're still a symbiotic unit, and you need to think of yourself as being pregnant. And this is where that baby's going to spend most of the time, either on you or on another support person, because this outer womb is where they are destined to make that transition from inside life to outside life, where it's colder and louder and a lot different than inside. So if you come out expecting that baby is going to sleep beautifully in your brand new bassinet, just like the picture on the bassinet says, that's a lie. It's not going to happen. The baby is going to want to be with you. They're going to go into their bassinet. Absolutely. You need to have a bassinet, a safe place for that baby to go down, but don't expect that you're doing something wrong because they don't want to be there for more than 10 or 15 minutes at a stretch, which can be really challenging in the first couple of weeks. So support is critical, making sure that you've got somebody there that can hold that baby when that baby is not happy to be put down, so that you can rest. Because if the expectation is, yay, my baby will sleep 17 hours a day, that's plenty of time for me to rest. That's not plenty of time for you to rest unless you're resting when your baby's resting, and you are making sure that you've got lots of support around you to really guard that first month when that baby is going to demand an awful lot of responsivity from you as a parent. Does change. They do grow. When they come out of you, they're only 25% hardwired, and all that hardwiring is happening at an incredible rate. So by the time they're 3 months, they will be very, very different little creatures than they are when they're brand new. But it can be really challenging. And I just want to take the stress off and get everybody just to breathe and to push back on any pressure that you're getting from friends or family. Guard that little, new family as it's been created, and give yourself a break for the first month. Don't expect as soon as the baby comes out, you can get back on stuff right away, because you can't. So just enjoy it. It goes way too fast. And before you know it, they're talking back. So enjoy it while you can.
I can, definitely, account for that because, you know, my children are now 9 and 5, but, you know, I wish that I had someone to tell me to immediately reduce expectations on myself going into the postpartum period with my baby. And a lot of people refer to the 4th trimester, about the period of time when your baby is home with you after they leave the womb, about the healing, obviously, that mom has to go through, but the baby is still thinking that it's in your body. So, you know, the whole connection that you have in the kangaroo care, skin to skin, like all of those things foster that secure attachment, but also allow for that time of healing between both of you for this huge transition you've both made into the world. Because you're now back to, you know, your prepartum self, but you're a different person now, right? You're no longer that person you were before. So I think that's such a good point. And I think we need to talk about it more, especially about breathe. It's going to be okay. This period is normal. Your baby wants to be on you. That's normal. And it's okay.
Yep,
You are not spoiling.
Not a prop. You are a parent. And that is an amazing thing.
Yeah.
That's an amazing thing to be a parent. But it means that we are a symbiotic unit for a little while.
Yeah.
And that does change as they get older, but it's just such an incredible thing to be. And I know it can be stressful. So really, guys, there are tons of great resources in this city. Having a baby here in Ottawa, couldn't have picked a better spot, honestly, because I've worked with all of these professionals all through this pandemic, and I know the work that has gone on to really try and make sure that there is great support for you. So please take advantage of it, because if you don't take advantage of it, it's easy just to fall through the gaps. And we're here and we're ready to answer your questions anytime you need them. Thanks. I could go on forever. You could just keep asking me questions, but I'll keep going.
You could just talk all afternoon. But thank you so much, Gillian. It was a pleasure for me to meet you, and it was a pleasure to have you kind of on our page and to get your face out there and to let people know, you know, we're still here, we're still providing support, we're still here for new parents. So much appreciated. And obviously for those who have joined in recently or midway or just at the end, please know that this event will be on our page pinned to the top for several days to come. And if you have questions and the event is done, don't worry, send your questions in. We have tons of public health nurses, and including Gillian, if there's a special question for her, that we'll make sure she gets back to you, or we'll get back to you with our answers as well. So thank you so much, Gillian. I hope that you have a great afternoon, and thank you everyone for joining. Bye. Bye, everyone.